Hello, this is Dr. Kevin Connors. You downloaded the book Beating Chronic Lyme, and this is separated into about 12 sections that you're going to receive a video just like this. This is a keynote presentation on video that will just help you understand the section as you're walking through it. I hope that the book sections are very beneficial for you. It'll give you a clearer understanding of how to deal with your Lyme and how to move forward from here. Always, you can contact our clinic if you have questions. Uh, Mainly in our office, we see cancer patients and chronic Lyme patients, and that's pretty much all I see anymore. It is an unconventional disease, and there's many conspiracy theories of why it is. Why aren't standard? Why is not standard medicine talking about it? And I may believe in some of those different theories. You may not, or vice versa. I don't know. We just don't know. There's a lot of unknown about Lyme disease. What we can share is some of the things that we do know. It started in the early 70s, at least, that we know the named Lyme disease came from Lyme, Connecticut, where a number of people started getting symptoms. And because of those symptoms that were undiagnosable at the time, they named the disease after it. So a collection of symptoms becomes a syndrome. It was initially a syndrome. It was given a name of a disease in the early 80s when Dr. Bergedorfer discovered the bacteria that was the cause of it, and they gave him the name of the spirochete. So it is a gram-negative bacteria. We're going to talk a lot about that through this program, and that is important as you're trying to kill it. Uh, and it is in the same family as H. pylori and some of the other gram-negative bacteria, and we'll discuss that as well because that can be a co-infection with Lyme disease. So typically it's Borrelia burgdorferi bacteria. There's a number of them. There's a number of co-infections. In my test kit that I use, I have over 100. So that's typically how we test for Lyme. We have to test for all the co-infections as well. In the 2000s now, as we're starting to recognize Lyme disease, even though the CDC still winks a blind eye at it. We're going to talk about what they recommend as far as testing goes and why there's so many false negatives in testing Lyme disease. Many states today are now passing laws that are making it protecting doctors that choose to treat Lyme disease. If you are a licensed medical doctor in most states, and if you're advertising that you're treating chronic Lyme, you are already got a target on your back. If you are using uh, antibiotics beyond the first month or two with Lyme disease, you got a huge target on your back. The big question with some people that are maybe labeled conspiracy theorists is why in the world would you put such a label on a doctor's back when the pharmaceutical industry seems to have um, an open door to create some sort of pharmaceutical that will at least alleviate some of the symptoms of Lyme disease. And that's what really kind of sparks the thought of a conspiracy behind this and how it all started, possibly as a created bacteria. And that's why there's some political advantage to keeping it hush hush. We won't go into that in this program. We really want to get into the different phases of Lyme disease and how to treat it because I don't really care on how it initially started and how it was created, possibly in a laboratory. We want to deal with the debilitating problem that you might be having. So in my book, there's 3 phases of Lyme disease, and we're going to hit this very hard throughout this whole book and this program. There's phase 1, which is an acute phase, which you really want to treat with antibiotics, and you want to catch it within its window, and we'll talk a lot about that. Phase 2 is chronic Lyme, and many people think that they have chronic Lyme, but they're actually in phase 3, which is an autoimmune stage, and that's why they can't get better. Phase 2, chronic Lyme, you can still treat with herbs and Th1 stimulants. We'll talk about that. When you're in phase 3 autoimmune Lyme, you can't treat it that way. And that's why people are still in the state of what this woman looks like in this picture. They have a lot of symptoms because they're already in an autoimmune phase. Well, if that's all new to you, you'll learn about that through this book, and it's probably much different than you hear about anywhere else. So read the part of the book if you that came with this video. I hope you enjoy it. Hope you start to understand a little bit different phase of Lyme, as far as different aspects of Lyme as far as how we look at it. If you have any questions, feel free to contact our office. Thank you much.